Hi, everybody. This is Dr. Sham. I'm a rheumatologist. I practice here in Chennai. So this is the next common thing. I think I might have touched a little bit on the initial one of the videos. See, many times whenever something bad happens to us, we always think, why me? The same thing also holds good for disease also. When we discuss, or when I see patients repeatedly, they think, or when they ask, the question will be, why I got it, why I got it. None of them in my family has, or my friends don't have. Why only I am suffering due to it? So definitely, even when we see patients, we see in a way, particularly with these chronic diseases, we expect or we hope that they don't have it, because we also know the difficulties patients undergo. It's not easy in consuming pills daily throughout the life, or doing regular blood test, or going to the doctor clinic. So none of these things are actually good. But what we have to remember is the genetic makeup of each of us, each one of us, is very important. See, though there are a lot of medical advancement, it's very difficult for us to find based on that. Maybe in future, I'm not telling in future it may not be possible. As of now, based on a genetic makeup. See, for example, this patient has this genetic makeup, so he is going to get this disease. See, we can't, as of now, that is not possible, because it's not only the genes. There are multifactorial. All these diseases, or autoimmune disease, or even thyroid, diabetes, rheumatoid, all these are multifactorial. So definitely genetic makeup is important, but that alone is not going to decide whether the patient is going to get a disease or not, whether he's going to get a severe disease or not. See, that is another important thing. One of the common examples many of my patients know, I tell them, is in autoimmune disease, it's basically our luck. For example, 0 is going to be very mild disease, 100 is going to be very severe disease. Where we are going to be, whether we are going to have very mild disease, something between 0 to 20, or we are going to have a very severe disease like 80 to 100. Because common example, many of us might see, there are diabetic patients who do very well with just exercise, lifestyle modification, because they are lucky the disease is very mild. There are patients who will be on just 1 or 2 pills, they have a moderate disease. Then there are patients who take insulin. Why I'm quoting diabetes is because most of us know about diabetes, so it will be easy for us to understand. Same with rheumatoid arthritis also. There are patients who will be on the very mildest of the mild medicine. Then there are patients who, even after giving the newer injections like biologics, they may not be able to control the disease. They may not be able to stop a painkiller, or they may not be able to stop a steroid. So it depends on the individual thing. So please don't never compare your disease with the, it might be the same disease of another person. Never compare it, because it will be different in different patients. So coming to the question, why me? So you need a genetic makeup. Then there are a lot of environmental triggers. So depending on the type of disease, for example, if it is going to be rheumatoid arthritis, smoking is one of the, or ankylosing spondylitis, smoking has been found to be a major environmental trigger. So at least the smoking, we all know it's not just for rheumatoid, it's for cancer or heart disease. So many harmful effects are there. So include arthritis also in that. So even if you're somebody is smoking, at least now we can stop, because I have seen some people taking treatment for rheumatoid and parallel smoking, which is not it's not a really nice thing. So that is something you have to remember. Then there are other things which are not our control, like for example, getting a viral infection, having a bad tummy, getting a GI infection like a diarrhea or something, that can trigger. Some people, it can be age, hormonal. Many times rheumatoid starts after a young female has a baby, like after the delivery. So in the postpartum period, due to hormonal changes, we do see a lot of patients having a rheumatoid arthritis. It starts at that age, or many times after the menopause. Once the menopause is the post-menopausal, we see the diseases starting. So hormonal changes are also sometimes helps in triggering the disease. That is another thing. Then some are age dependent. For something like what we call osteoarthritis, even a patient with rheumatoid arthritis can have a bad knee. In those people, definitely controlling the weight, not being overweight or obese, also helps. So you need a genetic makeup. You need 1 or 2 environmental triggers. So genetic makeup is not under our control. Remember that. Similarly, the environmental thing, except for few things like smoking, is also not under control. So always, please don't worry that somehow I got it. Remember, this is the reason for you to understand. But since both are not under our control, once you get a disease, main thing is how to identify it early, how to get rid of it, how to be taking medicines without any side effects, means how to travel safely, how to have a normal quality of life. These are the things we should think, and no point in going back and thinking why we got it. Thank you.